Right, staying with the PEPFAR funding cuts, I'm now joined by Professor Ramneek Ahluwalia, the CEO of the Higher Health, on the impact on post-schooling education and training. Prof, thank you very much for coming on this afternoon. Do you share the sentiment of the Medical Association as well, as far as the academia is concerned, that this cut in funding will be devastating, one, but two, that it also highlights the fact that foreign aid should never be seen as a permanent solution?
Good evening, Thabo, and good evening to all the viewers. Thabo, it's a sad day. Lots of South Africans have lost jobs. Lots of South Africans who were dependent on this aid for support are vulnerable. And there's no doubt there's a massive challenge that looms in the HIV response and TB response in this country. But it's 17% of our total investment. Higher health, from where I come from, we saw this quite a while back. This is foreign aid. This depends on other taxpayers. Any president, anybody from that other world can make any decision. That's exactly where we find ourselves in the world today. We believe that post-school education, basic education, where young people are, where the future of our economy is, where the vulnerability of our most important, one of the important youth population, which goes into workplaces, which helps to take this country forward. A hope of a mother is existing. We believed in not having foreign aid, to be dependent on our people, to be dependent on foreign aid, and for which domestic funding, finding innovative solutions from the very beginning were where we moved into. And today, we believe that it has impacted the entire country, entire situation. But from a post-school education, we kind of find ourselves very less vulnerable with the fluctuations that we've seen from the USAID. And that's purely because of resilience that we built while far back, that critical populations, key populations, they cannot be dependent on foreign aid. And I think it's an opportunity for South Africa to learn and to make sure that we cover all our funding gaps. We become self-reliant completely. I mean, any funding that comes from foreign aid or investments from other side should just be seen as an opportunity of acceleration and not just survival. Our whole country's full response should be fully self-reliant. And I think this is what is South Africa, I think, is very resilient. I do believe that if we all do our parts, higher education, basic education, social development, Department of Health brings in enormous amounts of ARVs and increases capacity for ensuring that patients don't go without treatment. We all do our prevention part, education. We should be in a position, our churches joins hand with us. We should be in a position as our country to hold our camp together. And I think that's what we need. We need to be united. We need to handle this challenge. We can do it. It's not, we far better than other African countries where the dependency was probably more than 50% on foreign aid. We just 17%, and this gap can be covered if there's a will, and conservatively we all come together and we can make it happen.
Prof, how did you then put yourself in this position where at least you are able to insulate yourself from the fluctuations in this particular aid to an extent that you're saying your programs might not be particularly as impacted maybe as other sectors? Did you, one, come up with alternative ways, or how did you get to a step where you became self-funded?
Very critically, domestic funding. We trusted South Africa. We kept very from the beginning informed the government that this population is a very sensitive population for our country. Higher education, our basic education, our education community, we should be absolutely self-reliant, strong enough. So we raised funds thanks to private sector, thanks to government together coming in together. So domestic funding is always both sustainable and stable. as far as possible when it comes to your own populations, you know. So I think the additional funding that comes helps you accelerate your programs, helps you scale up to, say, for example, the dependency of higher education with USAID has been the down referral, which means in case there are, so the prevention is completely taken care of. We do try to bring ARVs from our Department of Health. Our proximal in 9 MOUs with the Department of Health helps, or district MOUs with the District Department of Health helps in down referral. But where we had fantastic USAID sites, it's the down referrals can happen to their sites. So the people getting the ARVs, people getting pre-exposure prophylaxis, people getting medications or treatment can be much more easily accessible. What we have to now go into is the same system that we did. So you remember, USAID was only in 27 districts. We are 52 districts country. We are all over. So we had the formula on 25 other districts where the down referral worked very well with the Department of Health. We just need to keep putting the emphasis of strengthening the Department of Health, asking Department of Health to make youth-friendly services further, ensuring there's more capacity, ensuring that there are ARVs, so that the prevention programs that happens in education system, happens in other groupings or congregations, people are easily getting access to treatment, people get supplies regularly, people are mobilized towards treatment, obviously. So I think from our perspective, we are very self-reliant. We have gone to a route where in South Africa, across all universities, all technical colleges, all vocational colleges, community colleges, and I'm hoping with schools even, we have curriculums. We have ensurety that people go through HIV curriculum. So that's education is a fantastic phenomenon of prevention. Education is preventative in itself. So if we continue putting our education focus as prevention, ensuring our populations are understanding what is HIV, what are the indicators of HIV, talking about gender-based violence, talking about mental health, talking about drugs and alcohol, talking about transactional sex, every parameter, so that our population is aware and resilient at a very young age in order to understand, and they also can be screened through the education programs. Then all they have to do is to ensure that when we find that somebody is very vulnerable, link them to care at a very quick space. And I think South Africa can cover it. My aim is on a positive angle to say we are a resilient nation. It's 17% gap. If we all apply our mind and heart together, let Department of Health strengthen its district health, its community health system, its treatment program, and we strengthen our prevention program, and the synergies of the two worlds will make it happen for this country. We are far better than other African nations. My fear goes to African nations. I do think South Africa has the power to come out of this challenge. Doesn't mean this is not imposed on our country, but it means we have to become self-reliant. It's a trend. I mean, USAID is one thing you're seeing. German government has now gone through a new elections, and the new right-wing government is coming there. We saw the Swedish. We heard the other day the British Prime Minister saying that no foreign aid from Britain and all the money will go into defense. That's a trend all over the world. So it's every nation to look after its own people. So self-reliance now becomes a norm that we are finding ourselves into each country.
So as you put it, I mean, there are other countries also that are changing their funding policy. Is there a silver lining here? I mean, is there good that can come out of this, especially for South Africa?
It's a push to Africa. South Africa, I do think we are resilient. We will come out of this. I believe in our nation. I believe in our resilience of our population. Our funding gap is not that difficult. It's about 17% in the HIV and TB response. It has affected our research quite tremendously. It is going to put back a little for us for a time being till we group ourselves together to find a conservative way or a way of how the system will now operate towards self-reliance. But South Africa has the ability and capability to come out and become a fully self-reliable country or self-reliant country in our HIV and TB response. My heart goes to Africa. where other African countries were highly dependent. Our SADC countries were highly dependent on the US government and other donors like the Germans, the British, and the other elements of investment that was coming up. So I do believe that the fear factor goes from me as an African continent. They will take very long to be self-reliant. But the trend we see now with the new wing of government, the new style of post-Ukraine war, post-Gaza war, what we are trying to see is the world is reshaping in itself. It's pushing every country for itself. And it's at that development part of the thinking from each country to help the other. It should be for developed countries to support developing countries. That should be a good citizenship model, a good world to exist. But the reality we find ourselves is not that, which means each country needs to now find its own mechanism. The good thing is if the countries can find it and their dependency on other countries go away, it's the best news for the population of the country because the country is self-reliant. Education and health, the countries must always be self-reliant and not dependent on foreign aid because these are the two pillars of how a population must accede towards coming out of poverty, coming out of challenges, and keeping themselves health challenges away.
Prof. Ahluwalia, appreciate your time. Thanks so much for coming on this afternoon. That's Professor Ramneek Ahluwalia, CEO of Higher Health.